Hi, my name is Rick. I was diagnosed in 2019, non-small cell lung cancer, being given only 5 months to live, sitting here and basically cancer-free as of my last scan. And this is the story of my journey.
So we met Rick at the Metabolic Health Conference in 2019. We were there because, we're always going to different conferences. If it has anything to do with metabolism or chronic illness, we're looking for opportunities to share, with other people, usually practitioners, what the power of hyperbaric is and how it might be appropriate to be used in certain cases. The Metabolic Health Summit talks a lot about ketosis, fasting, and specifically how some of those therapies relate to cancer. Well, hyperbaric is also a metabolic therapy. We use oxygen to oxidize our fuel. So between shifting somebody from a sugar-based diet to a fat-based diet, getting them fasting, those are all mitochondrial therapies. Those are metabolic therapies, and hyperbaric plays an enormous role in that whole process. So there's a lot of synergy between using hyperbaric oxygen therapy along with other metabolic therapies in supporting patients who've been diagnosed with cancer. Rick happens to be one of those rare people who was taking his health into his own hands, going to a conference like the Metabolic Health Summit in order to meet the people that he needed to meet, pick everybody's brain, and develop relationships so that he had the right tools to put together a program and a plan. He had already been diagnosed with cancer about 6 months or so before that conference, and he had gone down a traditional road of care where he wasn't feeling like they were getting any improvements. In fact, they continued to see, new metastases show up in scans that he was getting. And so, he and his wife were really looking for what are some other options that we have to really start putting together a full plan. As you'll see in the video, that plan is robust. It does take an enormous time investment, financial investment. And as you'll see in the video, Rick is now cancer-free. And it was through that journey and through putting all these different pieces together that was able to be accomplished. And so we really wanted to put a video highlighting what his experience has been, what other tools he's used in addition to hyperbaric oxygen to create this well-rounded, multi-therapeutic approach to cancer, and of course, understand a little bit more about his journey.
Kind of went in along the metabolic approach. We did a lot of reading in Thomas Seafried, actually, and the ketogenic diet came along with that, along with like IVC infusions and off-label drugs. There was a lot of misinformation out there. Even like of all the people, our integrative oncologist was largely against it. And he introduced me to a guy who did everything they could to talk us out of it. And I'm like, nah, we're going with it. I don't see any risks in it whatsoever. And, after a lot of research, we went for it.
So you showed up at the Metabolic Health Summit, that's Dominic D'Agostino's conference, and I think that was February 2020, I believe, or early March 2020. At that point, had you already started any of the ketogenic or hyperbaric, or was that like the first step for you guys in looking for metabolic therapies?
We had started the ketogenic diet earlier that fall. Well, actually the spring kind of, but not really. Spring over the summer. And it wasn't until, it's like we were trying to queue up all these things, basically preparing our war chest, honestly, because the biggest thing we had read is these EGFR inhibitor that we're on had a really short lifespan. And so we were kind of preparing ourselves for what are we going to do when this stops working? And so we were kind of queuing things up, and that's where we had been to the Metabolic Health Summit and kind of started accumulating these ideas. And we actually tripped the trigger was in the spring. We had an advancing brain met in this left frontal cortex, and that was really scary. So we were like, okay, it's game on, like Donkey Kong. And we're just going to throw the kitchen sink at it, because at that point, it was just overwhelming. We thought we were going to die, honestly.
Could you describe, before your diagnosis, can you describe like physical and mental Rick before you even knew anything was wrong?
I was a very angry man, to put it bluntly. I was 330 pounds, ginormous, and eating really bad, drinking Mountain Dew, going to McDonald's. I mean, doing all the worst things you could possibly do to sabotage our health. I pretty much given up on life as it was, honestly. And it wasn't until we kind of found the Block Center in Chicago and connected with a bunch of you guys, and basically launched it all.
When people ask me about your journey, I usually say, you know, you had a lot of good people maybe pointing in the right direction, but ultimately it was your commitment that really led you to have the success that you've had. Can you explain to somebody, let's call it like there's periods like ebbs and flows, right? Like Thomas Seyfried would talk about, you know, pulse press, right? You sort of push a little, you back off, you push a little, you push a couple different things at different times. So in a more relaxed week, what does your therapy routine look like? And at a peak intensity of routine, what did that look like? Because I know that it's very intense. And so I would want people to know what that would look like realistically.
During the 5 days of we were on pretty much full time, day and night, honestly. That was doing IVC, IV curcumin, IV resveratrol, IV quercetin, diving before, sometimes diving after, fasting, intermittent fasting, taking all kinds of supplements, all kinds of off labels, in addition to the cancer drug, in addition to shitting our pants the whole time. It was not pretty, but in the week or two off, yeah, it was a little bit easier, but not really all that much. We were in the trenches, not going to lie to you. It's brutal, but you got to have the will and the motivation to do it. And thanks to my wife here, we did. We soldiered through it. There was a lot of days that I wanted to give up, but here we are today, and basically cancer free, and I think living our best life. And no matter what happens tomorrow, we don't care. It's truly amazing. We found God. We found our faith. Reconnected with my wife, who's sitting here.
So just to summarize, most days you're doing like a single to a double 90-minute dive. Most days on the days on.
Yep.
The days on, also taking a lot of supplements, probably fasting, and a full day of multiple IVs, one after the next.
Right, for 5 days.
For 5 days. A week off, you're still doing most likely a few either single or double 90-minute dives. You're still taking supplements. You're probably still fasting. You're just really not going to spend the entire day hooked up to IVs is really the biggest difference between on and off. Is that about right?
Maybe like 1 or 2 days picking up an IVC, high dose IVC.
At the peak, before you started down any of the other alternative roads, what was your prognosis at that time, like early 2020?
5 months.
They gave you 5 months to live?
Yep, that was it. They basically said, go home, get your affairs in order, spend some time with your family.
And when was your last scan?
August? Yeah, August.
Okay. And it was still clean?
Yep.
That's incredible.
Yeah, here we are.
Have you even seen any of the original doctors? You haven't never gone back?
We did for a little while. Actually, a good while.
Did you share with them any of the things that you were doing? And did they have a comment like,
oh, hell no.
Looks good, keep going that way, or stop, it's still dangerous?
Hell no. We didn't, we tried, but they didn't want anything to do with it, and they pretty much discouraged us from pursuing anything. for that matter. So it was about a year in the spring of 2020 that we started to notice. When we got in the tank, my thinking was clear, and it seemed like there was really something to it. And we just kept doing it and doing it and doing it and doing it, because Jason was basically encouraging us. He's like, dude, just don't give up. He's like, just keep doing it. And we bought into that pretty early on.
How long in between all the things you were doing did you start getting better scans? How long did that take?
I would say about a year and a half, because our scan cycle was like every 3 months. I don't remember exactly where we were at that point, but it was probably June, you think, of 2020.
So maybe you started doing, let's say, metabolic therapies, ketosis, fasting. You started seeing some changes of like energy levels and just overall like how you felt. Added in hyperbaric, started to see a little bit more, movement in that same direction, a little bit more brain clarity. But you were feeling those things, let's say, within a year or so of doing them, but it was at least another 6 months or so before the scans would catch up and start also measuring that improvement?
I would agree with that. It was about 6 months after starting the metabolic therapy and getting in the tank that the scans started to show improvement.
Have you read Tripping Over the Truth, Rick?
Yeah, Travis Christopherson. Yep.
Did that help you with Seyfried's work, or were you able to digest Seyfried's work on its own?
I wasn't actually. The first time I read
pretty hard.
Well, it was a mouthful, but I got through it all. I went and read a couple other books, and I circled back around and read Seyfried's book again, cover to cover, and it made a whole lot more sense.
So maybe can you share, if you have anything on the top of your mind, like things maybe you've heard from like Dominic, or what some of those other resources that you were able to read, because I would say something like, I think Thomas Seyfried is, pretty well the leader in the thought process on this, and his information is amazing. It's just not necessarily written for the average person to digest it. And
for
so
sure.
A few people have pulled out, that content and made it a little bit more easily understood for the average person to read. So what are some of those resources that you found helpful during that earlier part of your journey?
Christopherson's book is a pretty good one. I would say Nasha Winter's
That's Tripping Over the Truth.
Yeah, Tripping Over the Truth. Nasha Winter's book was pretty good. Keith Block's book was pretty good, as well as Jane McClellan's book was also really good. Believe it or not, Dr. Simon Yu's book, Accidental Cure, was really good. And I kind of read those in a different order, but in the end, I came back around and read Seyfried's book again. And that's when it all really made sense, was to see Seyfried's book again.
What would you want? Like, if I had a patient, I was like, Rick, I need you to talk to this patient. Very similar story. They're like right in the beginning of this journey. What do you feel like the top 3 to 5 things you would want them to either hear or know or think or do? Like, where would you want that conversation to start?
Pretty easy. Number one, you have time. Don't listen to your first oncologist. Number two, do some research. Get a second opinion. Get a third opinion. Get a fourth opinion. Get a fifth opinion. Whatever it takes until you're truly, truly satisfied. Number three, it's going to take more than one thing. You're going to have to throw the kitchen sink at it. You aren't going to know what works for you right away. It's going to take time. A lot of the things that you try are not going to work or not work very well, but that's okay. As long as they're not toxic and they're not hurting you, just go with it. The fourth thing, and this is really important, make sure to ask integrative questions of your integrative oncologist and ask conventional questions of your conventional oncologist. I can't emphasize that any more than that simple thing, because so many people I run into I said, well, ask them about vitamin C, ask them about hyperbarics, ask them about, no, it's a waste of time. Your conventional oncologists know absolutely nothing about these things, nothing. You need to get into an integrative oncologist, a holistic medicine person, an internal med doc, somebody like a doctor of osteopathy, something like that, in order to get these questions answered. That's the only way.
Great. Thank you. That's really helpful.
They are all over. Maybe not in the exact city that you live in. You might have to travel a little bit. Joel and I call it medical tourism. We've always made a joke of it, and it's kind of lighthearted, but she always wanted to travel anyways, and I was kind of a butthead, and I wouldn't travel, but this was a good reason to travel, and we would always take a side trip someplace, even if it was just for a day, and enjoy a few things. That's really what it takes, and then so you can go and meet those people, and then most of them will continue to treat you remotely, with an occasional in-person appointment. It costs money, but there are resources out there. There's scholarships out there. There's grants out there. There are people who will help. So don't let that be a barrier. Things were really tough, and we wanted to quit. It came down to our kids and family, and nothing else. And there is nothing else on this earth that really matters more than that. We really didn't know. Honestly, Jason came to us and said, Rick, we really don't know. There's some research to this and some research to that. But what we actually did is we hit all pressures, and we hit the ups, we hit the downs. And by that, I mean, going to 1.5 and then going to 1 3/4, going to 2.2, back to 1.5. It really didn't matter. It was an accumulation of hours, and obviously something worked. Jason might have a little more information, but that's about all I know.
What I said to Rick was, we just, and this is just the truth even today, we don't have enough research to know this is the exact plan, but we know that certain pressures have certain effects. And so and Rick is one of those, rare patients that just literally, what are we going to do? We'd map it out. And for the next 4 weeks, he did exactly that. And so I knew we were going to accumulate enough hours where we can focus on different pressures because they had different effects. So we could do a little lower, we could do a little bit higher, we can swing back and forth, we can do all the air brakes we needed to do. And so I tried to basically take everything we knew that did exist and combine it, into an overall plan that would allow us to hit, the majority of, the high points at each pressure range over a period of time.
There was just a number of moving pieces, and we just threw everything at it. And the hyperbarics is only one piece of the puzzle. There was cannabinoids, there was IVs, there was supplements, there was infusions, there was off labels. I mean, we have no idea what actually worked, but we do know that all these things work together in some mysterious way. And not to mention detox, which I'm doing right now. We pulled a bunch of mercury out of my head just in August. And, we're on Dr. Pompa's detox protocol right now because we're pretty sure that's what was causing the brain mets to keep coming back. So it's an ongoing process. It truly, truly is. We're never going to be done, at least with this first time around. Yeah, that's about all I can add to it. She's the greatest caregiver that a guy can ever have, and she truly is.
It's all about being persistent and wanting to get better, and not just sit back and whatever the doctor says, this is what I'm gonna do.
Obviously, it's impossible to go through this alone. So anybody who's facing, what you guys faced, and Rick is facing what he faced, and, you are the primary, caretaker in that role, what would you share with somebody who's going to play your role in that story? Any advice for that person from you?
They also need to have a good support system. You have to be a support system for whoever you're helping, taking care of, whether it's your spouse or a parent or a other family member, but you also have to have a good support system because it's a lot.
You guys are awesome. And number one, I always appreciate you and your willingness to share, because I think that's such an important piece for most people is like, I think I want to do this, but like, I don't know anyone who's done it. And it's really scary and I don't know what to do. And I'm not even sure it's worth it. And all my doctors tell me not to. So information like this is so critical to helping somebody, take that step. And everybody's journey, I believe, will be their own and it will be different. But I still think being willing and able to share this it's going to be very meaningful for a lot of people. And so I just want to thank you again for being willing to do that.
You're welcome.
Most of the patients that we end up interacting with have already had some type of diagnosis. In many cases, those diagnoses are pretty catastrophic. Many patients initially seek traditional care because that's the road we've all been exposed to. And so they have a diagnosis, they go down some traditional road. If that road doesn't take them to the place that they're trying to get with regard to improving their quality of life or potentially becoming disease-free, they then often look for alternative therapies. And within those alternative therapies, sometimes other answers show up. Sometimes the alternative therapies were the critical piece. I'm sure in certain cases, it's a combination of traditional care and alternative options that really needed to be brought together in order for that patient to get the results that they're looking for. In any case, when we're talking about non-traditional therapies, we're not talking about treating the disease. We're not saying hyperbaric treats and cures cancer. What we're saying is there's a pathology within that patient, and that pathology is creating a whole series of consequences and symptoms. And what we're looking to do is just trying to help restore normal function. And so we can put a patient through different dietary changes, different supplement changes, different other modalities like hyperbaric or red light or sauna or cryo. What we're doing is we're restoring normal, healthy cellular function. And so many times as we restore normal, healthy cellular function, the body is able to do what it does best naturally, which is to heal. And that's really all we're doing. We're not treating their disease. We're just treating the person and trying to restore that healthy function. And healing is the consequence or the benefit of that process. Cancer, just like most chronic illnesses, don't have a singular cause. It's an accumulation of inflammation, mitochondrial dysfunction, toxicity. It's an accumulation of issues that, when combined inside the body and are chronic in nature, continue on and on and on for years, decades even, the body has a hard time clearing it out and ultimately reducing inflammation, restoring normal energy production, healing the mitochondria, and becoming healthy again. And so just like these chronic illnesses, cancer included, are a accumulation of multiple issues over a long period of time, the solution is not going to be a singular solution. The solution is going to have to be multi-therapeutic, multiple therapies combined, usually over a course of time as well. It's not like all these therapies come by and, in 3 days, everything's gone. We have to combine multiple therapies over a period of time, maybe not years and decades, but certainly months and maybe even years, in order to create an environment back inside that body that's conducive to healing. If we can shift the environment inside the body, just like the disease is caused by a shifting environment, towards an unhealthy and inflamed cellular environment, if we can create a healthy environment inside that same body, we can start to see healing and recovery. And so we have to learn how to combine all these different therapies for people to shift the internal environment to allow that healing to take place. As we said in the video, everybody's journey is going to be unique. There might be certain principles that are similar because how we go about helping a patient heal metabolically, improving their energy production, reducing their toxicity, reducing their inflammation, there's going to be themes that are similar throughout. However, my version of that story, Rick's version of that story, your version of that story, they're all going to be different because you're different, you're unique, and your set of circumstances are also going to be unique. That being said, the biggest thing you can find is a team of doctors that you trust that all understand that the goal is just to help the patient heal. And they're willing to talk to each other and co-treat and manage, a complex patient in a way that, removes ego and allows them to focus on what's important, which is, helping that patient heal. So I hope you found this video helpful. I hope that the information in here at least provides some hope and inspiration to make sure that you take the necessary steps you need to take, or that you have to encourage a loved one to take, in order to start looking for these bigger picture solutions for whatever you have going on. Just remember that you have to remain hopeful and understand that there are solutions. Just because one doctor doesn't know what they are doesn't mean you stop there, right? And so just like Rick said, you've got to get a second, a third, a fourth opinion. Everybody just knows what their experience has taught them. And so you're looking for people more experienced with what you have. Again, I hope this video helps, but if you have any questions or comments, please feel free to leave them below the video, and we'll do our best to answer people or steer you in any direction that we can to help you begin that journey.